Like Osgood-Schlatters in the knee, Sever's pain in the heel can be a real nuisance to young athletes and sometimes can be confused with other reasons for foot pain in the athlete. Hi, I'm Dr. Randy Goldstein. Let's talk about Sever's. Sever's, also called calcaneal apophysitis, occurs in growing athletes. It almost always happens at the exact spot that the red circle is shown, on the back of the heel, side of the heel, and on the x-ray at the top of the screen. If your heel pain isn't where the red circle is, it's unlikely to be Sever's. Sever's occurs because the Achilles tendon is yanking on a relatively weak growth plate. So if you're not growing anymore, then it's probably not Sever's. And if it's not where the red circle is, it's probably not Sever's. Here are some examples of places that can be close to where Sever's occurs, but it's from something else. There at the bottom of the foot is where the plantar fascia is. And plantar fasciitis doesn't usually occur to young athletes, but it certainly occurs in older athletes. And Sever's typically doesn't have pain with heel rocking, grabbing the heel on both sides and moving it back and forth. And lastly, Sever's doesn't occur at the ankle. So if you're having ankle pain, this is probably not caused by Sever's. Sever's pain in the heel is similar to other problems that occur in growing athletes in different parts of their body. Apophysitis and osteochondrosis are two terms used for different causes of pain at the growth plate where a tendon is yanking on that growth plate. Osgood-Schlatters of the knee is an example. So is Sinding-Larsen-Johansson of the kneecap, both from the patellar tendon yanking on a relatively weaker growth plate. Olecranon apophysitis of the elbow is an example, and so is Island's of the fifth metatarsal of the foot. There's other examples too. These are just a few to give you an idea that this problem occurs in more areas than just the heel. They're all treated similarly. The history is important. It's usually in a particular spot where the red circle is shown. And stretching the Achilles tendon on the exam often causes the heel pain to get worse. It has to happen in the right age group. If you're done growing, you don't have Sever's. You don't have to be 11 to 15 years old if you're a boy, but that's when it's most seen, and in girls a little younger, 9 to 13 years old. There's typically not a reported injury, and often both heels hurt at different times. For instance, maybe for a couple of weeks the right heel hurts, and then several months later the left heel starts to hurt. And it's typically off and on. Not every day, and not always bad. Sometimes not as bad, and then after sports especially, it gets worse. If heel rocking hurts, moving the heel back and forth, it could be Sever's, but it's probably good to think about other things as well, such as a bone bruise or stress fracture. And if there was an injury that started the heel pain, it could be Sever's, but probably worth thinking about something else. If there's a limp, worsening pain over the course of 2 or 3 weeks, or heel rocking pain, it probably deserves at least thinking about something other than Sever's. You don't have to x-ray Sever's, but we often do just to be sure that we're not missing something else. And rarely we need to MRI Sever's, but here are some pictures to show you what it looks like if you did. The green arrow is showing you the Achilles tendon, and the blue arrow on the left picture is showing a growth plate of a normal heel MRI. The red arrow is showing the same growth plate of an MRI with Sever's. Notice all the white inflammation or edema surrounding the growth plate. This, if you MRI'd it, is what Sever's might look like. Although sometimes when we MRI Sever's it looks completely normal, but because the history and exam fit, it can still be Sever's even with normal imaging. What else could heel pain be if it's in the right spot? Well, here's an MRI of a typical Sever's case, and remember we don't usually MRI them, but it's for an example. The right image is a stress fracture. Let's look at the differences. On the left image of Sever's, the blue line is where the growth plate is, and most of the inflammation or edema or white area is where the yellow circle is right around the growth plate. On the right image, the white area, the edema, the inflammation, the injury, isn't just around the blue arrow where the growth plate is. It's also within the calcaneus. This is a stress fracture and should be treated differently than Sievers. The green arrow shows you where the plantar fascia is. If there was plantar fasciitis, this would be white or edematous or show inflammation. And the green arrow here is the Achilles tendon, where there could be Achilles tendonitis or an Achilles injury, such as a tear. Now let's talk about the treatment for Sievers. One is to stretch the Achilles. A tighter Achilles may put more stress on the attachment where the growth plate is, and a relatively more loose Achilles may cause less pain to the athlete. Icing after exercise is important to decrease inflammation. I like half water and half ice in a bucket for 5 minutes. Good soled shoes can help if your sport has shoes, and for those that don't have shoes, a heel sock can help. A heel cup can be put into shoes to pad the area and hopefully let the athlete continue with tolerable amounts of pain, so long as there's no limping. Modifying impact when you can is helpful. And finally, ibuprofen or naproxen with food to help protect the stomach, but not daily, as this can harm the stomach or kidneys. Non-steroidal anti-inflammatory drugs can be considered for an important day, like during a competition, or a particularly bad day that's really bothering the athlete. But if you're using ibuprofen all the time, it's time to see the doctor to make sure there's nothing else that can be done to help. Night splints can be used as well. I don't typically start with this, but it's something to consider. Sievers can be a real nuisance, and while it's usually not dangerous, and most athletes can work through the pain as long as they're not limping, it can be something that can last a year or more, off and on. It's those athletes that are limping or having worsening pain, can't get through their practice, or are using lots of ibuprofen and the heel cup isn't working. Those kids need to be seen by a sports medicine doctor to make sure there's nothing else that's causing their pain that we can make better, such as a boot for a stress fracture, or physical therapy for plantar fasciitis or Achilles tendonitis. There are other things that can cause heel pain in this age group, but Sievers is very common. And if you have it, we can help you at least get through the sport with less pain and make it more enjoyable. This is Dr. Randy Goldstein. Stay well.